Today I'm going to demonstrate for you gastric tube feeding. There are many reasons why we feed with a tube, which is called a gastric feeding tube. Have you ever wondered what it'd be like to not be able to eat by mouth? There are many reasons why we can't eat by mouth. Sometimes it's from an illness or an injury that you may have gotten from a head injury or something. So in that case, they would use, for temporary use, a nasal gastric tube, which goes in the nose and into the stomach. But then there's the gastric tube, which is placed into your stomach, and it's more of a permanent tube. So these are used for people that may have been born unable to eat by mouth, or later down the road, for whatever reason, not able to eat again by mouth. So this is pretty near and dear to my heart because we have identical twin daughters who have to eat this way and have for 27 years. And so there are a few things that you need to do to get prepared to feed a child with a gastric tube. And the first thing you need to do is gather your supplies, and what we use is 60 cc calf tips, and they have a small end on them that can be placed into the tube. So we would need one for the formula and one for rinsing. And so we would need the formula, and most people who are tube fed are fed with a special formula. Sometimes they can have milk or whatever, but most times it's an elemental type of formula. Then we would need our sterile water to rinse the tube prior to feeding and after. There are different types of adapters that you can use to the end of the tube. So this adapter wouldn't fit here, so we would need a special adapter so that this can be screwed on. And that works better so that once you've screwed it onto the G-tube, the food can't come out. It's easier. So once you've gathered, one other thing too is a split 2x2 is something else that you would need. This goes in between the stomach and the tube, and it prevents skin breakdown and that kind of thing. And then paper tape so that you can tape the tube down on the stomach so the tube doesn't come out of the stomach. So the first, you would also need some gloves. That's important. So the first thing you'd want to do is wash your hands after you've prepared the formula. And usually you can make the formula 24 hours ahead of time. You make it and it's good for 24 hours. So you make the formula, and I like to leave mine out for about a half an hour before I feed the child so that it becomes room temperature, because it wouldn't feel good to have cold milk or cold formula put onto your stomach. So you want to leave it out at least a half an hour. After you've gotten everything prepped, you want to wash your hands and have a clean surface. And so you want your child to either be sitting in a chair, or if they're laying down, at a 30-degree angle. So you would put your gloves on, and so that's what I will do, is put on my gloves and get ready to feed. And I like to talk to the child while I'm feeding her, because it's just like you would be at the kitchen table. You would want someone to interact with you while you're eating. So you just talk to them and say, we're going to eat today, and are you hungry, and that kind of thing. And so a lot of these tubes do not have a clamp on them, so you got to be very careful. So I always clamp it right here at the base. And then I get my tube ready, and I open the valve, and then I take this tip, screws onto the G-tube like this. And so then I kind of let it down like this, and it releases air, almost like when you have a burp. So they need to burp, and so we let air come out. And then I would proceed to take sterile water and put about 30 cc's of fluid into the tube. And I would let it go, go down kind of slow. So you kind of bring it down like this so that the tube feeding doesn't rush right in. So you bring it down slow, and then you take the formula and you put it in. So you want to put in, usually you eat about 4 ounces of formula. So you would release it and let it go in slow. When you're finished with that, you would then rinse again with 30 cc's of water. Then you would unscrew this after and place the cap back on. And then you watch the child for any type of coughing or gastric upset. And then they can go on and play with the rest of their day until it's time to eat again. Then you want to clean the supplies and get them ready for the rest of, for the next feeding. So that's how you do a gastric tube feeding for a child. Thank you very much.